Hi everybody, this is Dr. Sridhar Vennamaneni at Prathima Hospitals, Kukatpally. Today I just want to educate you on current infection that's spreading in Hyderabad for the past 6 weeks. We've seen a number of patients with presenting with high fever and weakness and cough in the last 6 weeks. This infection is called influenza. It's a virus, commonly we call it flu, and all over Hyderabad we've seen numerous cases of this infection. And it's a seasonal virus that spreads similar to coronavirus. Somebody around you who's sick starts sneezing or coughing, the fine droplets in the air, if you inhale them or if they get onto your face, or if you're touching a surface, a doorknob, or if you're sharing some towels, utensils, then you can get this infection. Most patients, once they're exposed to somebody who has this infection, you don't develop symptoms immediately. It'll take about 2 to 4 days before you may start developing some symptoms. The symptoms could be just generalized weakness. Initially, you could just feel very tired, a lot of sweating, and you can have cold and cough, sore throat, or sudden onset of severe fever with cold and cough is most likely influenza. The infection can make you really sick. You can feel like extremely weak, a lot of sweating throughout the day and night. You'll be coughing a lot at night. And this infection, if not treated quickly, can lead to pneumonia. So if you develop any of these symptoms, and in children, small children, you can even have, in addition to vomiting, you can have diarrhea, abdominal pain. But if you're short of breath, having a lot of chest pain when you're coughing, then you need to be evaluated to make sure you don't have pneumonia. So the infection spread is through somebody coughing around you or sneezing, or if you're in a place where there are a lot of crowded people, whether it is a restaurant or if you're in a boarding school, the risk is very, very high because people are not wearing masks. The infected person is not taking any precautions. Very easily this infection can spread. Now, how do we diagnose this infection? There is a nasal swab, just like coronavirus. We have a swab that can be a nasal swab to look for influenza A and B. And once we suspect this infection, typically we can start you on an antiviral medication. And the sooner we start the medicine, the better for you, because the efficacy of the medicine is great when you start the medicine within the first 2 days, 48 hours. Once you go past 48 hours, the medicine will work, but by then you already have severe weakness. There's a risk of developing pneumonia. So our suggestion is, if you develop high fever with sudden onset of weakness, severe cough, don't waste time. Just get to the doctor. You most likely have influenza. And you see a lot of times, I've seen patients being treated with antibiotics, which will not work because this is a viral infection. Who are the patients who are more prone to developing severe infection? These are patients, young and small children, pregnant women. They're at a higher risk for developing complications like pneumonia. You also have patients who are immunocompromised. If you have diabetes, if you have autoimmune conditions like rheumatoid arthritis or lupus, and you're on immunosuppressants, or if you're on any kind of cancer chemotherapy, then your risk is much higher. In fact, there's one way to prevent this infection, and it's by, in addition to wearing masks and taking precautions, the other thing is to get an influenza vaccine. There is a seasonal influenza vaccine. Every year the vaccine changes because the virus changes every year. So based on infection, the vaccine changes. So if you get a vaccine, influenza vaccine earlier, like sometime in September or even in October, it's still not too late, because this infection can keep spreading from now all the way until winter months end. So you're looking at until February, there's a risk of contracting this infection. So one way to prevent this infection is to take the influenza vaccine, which is available in most of the pharmacies. It's a simple, one injection to your arm, and that should take care of the prevention of the infection. In terms of treatment, get to the doctor and get started on antiviral medication, the better. And usually it's a 5-day course of antiviral medicine. And the sooner you start the medicine, fever will subside, but this weakness can last for almost a week or more. You could have cough that can last for 1 to 2 weeks or even more in some patients. So for the coughing, obviously you need some cough syrup in addition to plus or minus steroids, if need be. This is basically, if you have high fever, sudden onset of weakness, fever, cold, cough, you most likely have influenza. So don't try to go to the pharmacy and get started on antibiotics, because they won't work. So if possible, you should be started on antiviral medications. Thank you.